I would like to introduce Celeste King, a representative with Brainchild Nutritionals. We're going to be talking about a starter approach to supplementation. Hi, Celeste. Welcome.
Thank you, Kristen. Thank you for having me today. I'm hoping I can get some information to everybody here that's going to allow them a little bit more knowledge and comfort in terms of choosing supplements today. And if you have any questions in the middle of my presentation, please feel free to stop me and ask.
Wonderful. I know this is definitely a topic where families, even myself, having a child on the spectrum, you get really confused even when there's just so many out there. And then often you go to conferences and there's even, rows and rows of supplements and you're thinking, goodness, where do I even start? And, which ones do I trust? And how do I read a label? And which ones do I need?
Exactly. It's overwhelming.
It's so overwhelming. This is going to be a great hour. So I appreciate you taking the time to help our families and to kind of be our navigator and our tour guide through this. Because I think it's definitely something that many parents get overwhelmed, and then often they don't do anything, or they don't do enough, or they do too much, and they don't remember why. That's at least for me. I've given supplements. I'm like, why am I giving this one again? I can't remember.
Exactly.
I've been giving it for so long.
Exactly. And everything we're going to talk about doesn't require a doctor's prescription. It's something that a parent can go out with next week and start, going ahead and choosing products that are going to help them benefit their kids.
Wonderful. So what kind of supplements should a parent even consider when starting with nutritional supplementation?
So in building a good base of nutritional support, I'm going to recommend starting with something like a multivitamin and multimineral, omega-3s, which you find in your fish oils, probiotics, and enzymes. The RDA is going to give you like a minimum amount required to prevent disease, but it's basically less than what's really needed for optimal mental and physical health. So your body's going to need these nutrients to properly detox, restore itself, and protect itself. And so nutritional supplements are a good way to boost key nutrients that you may find lacking in your diet, or you may need extra amounts in to overcome metabolic problems. And you also want to keep in mind when you're starting like a new supplement regime like this with several products on board, that I recommend you start with one product at a time and build up slowly. So you're going to start with a partial dose and build up to a full dose over a period of time. That way you can observe any changes that might occur with a new product.
So it's a low and slow method then, right?
Exactly. Yep.
Yeah, I think that's so important to families out there, because often you get so excited and you go, oh, I want to give it all. And a lot of times, our kiddos are pretty sensitive. And so it's great when we go low and slow and we can really figure out the dosage that they really need, because it's not a one-size-fits-all. And then you can see what reactions you're getting, if any, as you're supplementing. Would you agree?
I would, and it's I'm going to give you a few ideas to start with, and like I said, it's overwhelming when you start all at once, and you don't get your best transition and your best results by doing it that way. So really giving your child's body time to adjust into nutrients and make a gradual transition will give you the best results.
Wonderful. So why are nutritional supplements so important for children with autism?
So children with autism, there's a number of nutritional deficiencies common with this disorder, such as zinc and magnesium and calcium deficiencies. There's also going to be inadequate levels of vitamins such as B6, B12, D, E, and A, along with omega-3 deficiencies, and also something important in terms of having low plasma sulfate, which we'll kind of revisit when we start talking about some of the impairments. So all these nutrients are going to be needed for the optimal growth and brain development. And so when you work with nutritional supplements, you can find this helpful when addressing deficiencies and also in helping to balance out some of the metabolic impairments, commonly found with this disorder.
And so why are there so many nutritional deficiencies, for our kids?
Well, a lot of children on the spectrum are going to often restrict their food choices and be self-limiting with their diet. There's also children with yeast issues that can result in craving a lot of highly processed sugary foods, which have poor nutritional value. So it's easy just in terms of that poor Western diet to set yourself up for these deficiencies. Also, children on the spectrum have issues with chronic diarrhea and constipation. And along with that comes things like poor digestion and the absorption of nutrients due to enzyme deficiencies and an abnormal gut flora. So with all that together, it's common to see things like a gastrointestinal inflammation problem and impaired metabolisms. So it's a tough process in terms of getting those nutrients in and absorbing them well.
And so when you're talking about metabolic impairments, do children on the autism spectrum commonly have all this stuff going on in their systems?
So there's a number of dysfunctional cycles in autism. There's going to be detoxification problems. There's going to be intestinal inflammation and GI symptoms, like we just mentioned. They're going to have oxidative stress issues. There's going to be immune dysregulation and also neuroinflammation. So these metabolic abnormalities are going to really compromise their ability with their metabolic pathways, and you're going to find things like methylation problems and sulfur metabolism to be pretty severely compromised. And so this functioning poorly in people with autism really sets them up for crashing in a number of ways.
And so, I know most parents, when we have our babies, we don't ever think of, when our child's methylating or what these words mean. And yet you go into the autism community and all of a sudden these big, I usually joke and say 10 to 17 letter words come at you and you're like, what does that mean? So when you're talking about being, a child methylating, what does that mean?
So it is a big word, and basically this is an important process in our body which is going to be essential for the proper function of all our body systems. So it's just so profound in terms of how we function in our having a healthy metabolism. It's going to support removing toxins from the body. It's going to repair the DNA on a daily basis. It's going to help keep things like inflammation in check. And it's also going to be critical for the production of neurotransmitters. And this is also a huge issue for kids on the spectrum, too. What basically is going to happen with methylation is that there's going to be a methyl group, which is going to be one carbon, 3 hydrogens, and it's going to transfer from one molecule to another. So in the methylation pathway we're talking about here, the methyl group is going to attach to a gene in our DNA. And this is going to have the effect of turning the gene on or off, and it's usually going to be off. And as a result, that changes the expression of that gene. This is going to have serious effects on how our body makes proteins, enzymes, and all the molecules necessary for a healthy metabolism, since it's going to be our genes that carry the instructions of how to do this. Once this is impaired, all the processes we spoke about earlier for methylation, such as detoxification, reducing inflammation, the production of proteins and neurotransmitters, are all going to be compromised. And they've found that autism is going to be one of those growing numbers of human disorders that have this abnormal DNA methylation.
And so are there any other problems that the child might be having other than that?
So sulfation is another issue. It's not a new topic. There's going to be impairments with something called the transsulfuration pathway. And this is intimately connected with the methylation pathway. And research shows that the majority of children with autism have a greatly reduced level of plasma sulfate. So the sulfur is really an issue for kids on the spectrum. The 2 reasons that sulfation can be a problem is that it can have a profound effect on the gastrointestinal lining of the gut. And we're going to go back to digestion and gut a lot today. The lining is made up of sulfated glycoproteins, and these are proteins that rely on sulfation to maintain and repair themselves. They also have protective and adhesive properties. So if there's a reduced sulfation to them, it can cause inflammation, gut dysfunction, and also increased gut permeability. And this is what you're going to hear of as the leaky gut, which is where the small intestine becomes damaged and permeable. And that way that allows food particles and proteins and chemicals to travel into the bloodstream. And that causes a host of problems, such as immune reactions and food allergies and intolerances. Another reason sulfation can be problematic for children is that it's also going to play an important role in detoxification. And people with methylation and sulfation deficits will be less efficient in removing toxins from their body. The other thing that reduced sulfation can be related to is impaired glutathione metabolism, another big word.
So why is that so important when you're saying glutathione metabolism?
So glutathione is going to be the most powerful antioxidant naturally occurring in all the cells of the body. It's an intracellular antioxidant that we make within our cells. It's made from 3 amino acids, glutamate, cysteine, and glycine. And glutathione deficiencies have been observed with autism. And when you have environmental toxins working against you, this can play a role in depleting glutathione levels as well. And it's also going to play a substantial role in the functioning of the body's immune system. So it's going to aid in detoxification of the body. And as glutathione levels decrease, so does your body's ability to eliminate those dangerous toxins. It also helps to recycle vitamin C and E. So after they've been oxidized, you want them in the reduced form to be helpful for the body and to play their antioxidant role. And vitamin C helps to recycle that so that they're maintaining the normal function.
Now, can nutritional supplementation help with these impairments? And are there any behaviors that we can, are there red flags that we should be looking for to kind of know if our child is experiencing any of these issues?
Yes. So far we've talked about several impairments common to autism, such as methylation, sulfation, and glutathione deficiency. In regards to methylation, there are going to be several B vitamins that are going to be key players in the methylation process. And finding them in the right form is going to play an important role in terms of how helpful they'll be. So the first one we want to think about is something called folate, or vitamin B9. And the synthetic version of B9 is called folic acid. And this is going to be a fully oxidized synthetic chemical. It costs less and it's more stable, so it's easy to put into supplements, more so than the natural form of folate. But this form of B9 is the one that you want to stay away from, because children with autism commonly have a genetic variation in a gene called MTHFR. And that's going to cause impairments with their methylation cycle, and they're not going to be able to process that folic acid correctly. There is a form of folate that you do want to look for. It's abbreviated as 5-MTHF, or it's the 5-methyltetrahydrofolate form. And children with methylation impairments can use this form of folate. So that's what you want to look for when looking at a supplement. Another important vitamin you want to be careful for in selecting methylation support is vitamin B12. This is going to be a critical nutrient for nerve health and also for the construction of red blood cells, and it's also very protective for neurons. You'll most commonly see it listed in supplements as cyanocobalamin. However, this is the form of B12 that the body's unable to use, and it needs to be converted over to an active form of B12 called methylcobalamin before the body can actually use and metabolize it. Methylcobalamin is going to have several advantages over cyanocobalamin. It's going to have better absorption and retention in the tissues. It's going to support methylation, and it also has therapeutic applications that cyanocobalamin does not have.
Wow. So for all the families listening out there, I'm hoping they're taking notes because, as a parent, we're not told any of this, when our babies are little. And I wish they had more education on this for prenatal and then also during pregnancy. And I just think this could help not just children on the spectrum, but this can help all of our kids. Wouldn't you agree?
I really do, and I'm going to give you the name of a book at the end of the presentation that we just put out a couple years ago, and it's going to go a lot more in depth in terms of supplements and what you spoke about earlier when you're seeing signs like maybe you have somebody that has a lot of inattention problems or detox problems, and it's going to put, recommendations for that, particular concern together in its book as well. It's been written by a doctor and a nutritionist, and it really targets ADHD and autism. So I can give you that name at the end of the presentation, and I would encourage parents to kind of look further, more in depth of what we're going to be talking about today, because there's so much that goes into almost each and every process I'm talking about that I'm really just kind of glossing over the basic points of it.
Now, besides the B vitamins, what else can we do to support, trying to methylate and do well in our bodies and try to just be an overall healthy individual, right?
Exactly. I mean, we're speaking primarily, in regards to autism, but this is something parents often suffer from. The mothers and fathers can certainly probably relate to some of the things we're talking about as well. And some of the other nutritional supports you can look for are TMG, that's going to be trimethylglycine, also referred to as betaine, and this is going to be a methyl group donor that's going to promote methylation. So it's kind of a complicated pathway. It's got a number of loops, and I don't want to get into bogging down in terms of, what every step is called. But basically what you're going to look for is methylating a molecule in this pathway called homocysteine into methionine. So one of the routes that homocysteine takes for methylation is TMG. The other route that homocysteine is going to take to be methylated is the folate and B12 we've talked about. So these are two important routes for homocysteine to methylate with. Once it converts into methionine, then it's in step in the process of methylation to once again methylate our DNA, which is what is going to support that healthy methylation and metabolism. So one thing also here you mentioned about the things you could be looking for if you see one of these impairments, and one of them is going to be the transsulfuration pathway. If that's not properly functioning and you have phenol issues and so forth, you're going to see those red cheeks and shiners under the eyes and so forth. That can kind of cue you in that there's a sulfur issue or a phenol issue. And also, if this homocysteine does not methylate into methionine and going into the methylation of DNA, then it's going to go down a transsulfuration pathway to make glutathione. So two very important pathways this molecule travels through. The nutrient that can help with this transsulfuration pathway is called NAC. This is going to be helpful in providing cysteine, which is going to be one of the precursors to glutathione. And it's also going to be an important antioxidant factor for the brain. Stanford is doing a study right now that shows that NAC has lower irritability for children with autism, as well as reducing some of their repetitive behaviors. Another good multimineral that you want to look for in terms of supporting methylation is going to have a zinc and magnesium component to it as well.
Now, why is zinc and magnesium so important?
So magnesium is going to regulate over 325 enzymes, so it has a profound metabolic influence on your body. And it also has a calming effect on the nervous system. It's going to help to reduce inflammation, high blood pressure, as well as supporting the metabolism to flush out toxins out of the body. It's been referred to as like an anti-stress mineral, and so it eases the stress and reduces that hyperactivity and stimming and anxiety children on the spectrum may experience. And it also can sometimes help with sleep. A good form of magnesium to look for in the supplement is something like a magnesium glycinate. This is going to have a high level of absorption, so it's a good choice when trying to correct a deficiency. Other options are going to include citrates, carbonates, and sulfates. And there are also topical products such as magnesium oils and Epsom salt baths if you're looking to increase magnesium through other ways besides oral supplementation. You do probably want to avoid magnesium oxides. Those are going to be poorly absorbed and quickly excreted. The main side effect if you're having too much magnesium is going to be loose stools. So if that happens, you want to cut back on your dose to something that's a more better tolerated dosage. For zinc, there's going to be more than 300 zinc-dependent enzymes in the body. So again, very profound in terms of all the metabolic processes it's involved with. It's going to be important for brain development. It's going to be important for your immune system, amino acid metabolism, toxic metal metabolism, digestion, and also with methylation. Well-tolerated forms of zinc you can look for are going to be the chelates, the citrates, and the glucanates, and the acetates, but you may also want to avoid the oxide form of zinc as well.
Now, what other considerations do we need to think about when looking at multi-mineral supplementation? Because I know that's a big thing out there right now, especially in the autism community.
Minerals are really important, and so you kind of want to look for something, again, that's going to give you a nice broad base of support. It's going to have, you're going to see minerals in there like selenium, which has the antioxidant properties that works well with vitamin E and helps to prevent free radical damage to cell membranes. Manganese is going to be a cofactor in a number of important enzymes that are deficient in autism spectrum disorders. MSM is going to help increase metabolic sulfur, and you may also want to make sure you have molybdenum, which is going to be a cofactor in sulfur metabolism. So if you're not metabolizing sulfur well, make sure you can find the molybdenum in your mineral supplement or supplement it additionally in addition to whatever else you're taking. For calcium, you may want to look for a supplement this separately. It's going to be especially important for a child who's on a dairy-free diet. I like to give this one at night because it relaxes muscles and sends out calming neurotransmitters. So again, it kind of works really well for children kind of approaching that sleep time of day.
What was that
it's going to be calcium. So
calcium. That's what you said. Okay.
Yeah. So this is one of my nighttime supplements because it's really going to kind of put that restful, space in place for your child in terms of getting calmed down for the night. It's essential for bone health and tooth development, and it's also really important for neurological functions. Many functions are going to depend on calcium. It's going to help with releasing those calming neurotransmitters, muscle contractions, and membrane permeability. And it also works very synergistically with nutrients such as magnesium, vitamin D3, and K2. So if you can find a supplement that has these cofactors present, that would be ideal. And when you look at minerals, a lot of times you're going to see them listed as chelates in the ingredient list, and those are also considered very absorbable forms of minerals.
Now, what is chelate? I know that sometimes people get a little confused what that means.
So a chelated mineral is going to be a mineral bonded to an organic molecule, such as an organic acid, that your body absorbs well. Then this, in turn, is going to enhance the absorption of minerals. So when it goes down into your intestinal tract and your intestinal wall sees that amino acid, it's going to absorb it in, and the mineral is going to be absorbed as well via piggybacking onto that amino acid. So it's generally considered a very absorbable form for minerals, and again, we use it in our products, and we find it really helps to balance deficiencies.
Now, what else do we need to know about multivitamins? Because I feel like when you go to the market or health food store, there are just aisles and aisles and aisles and aisles and aisles of them, and it gets very complicated, as we said in the earlier part of this call. What do we really need to know about them when we're looking at them, and how do we figure it out? How do we know which ones to pick, and how do we know which ones are the ones that are going to help our kiddos?
So again, we kind of go back to the form of some of the vitamins in the products and in the multivitamins. So, for example, with vitamin A, that's going to support your immune system. It's going to protect against viruses. It's going to be critical for vision and sensory perception. It's also going to be necessary for growth, especially in the gut and brain tissues. But what you want to look for when you're looking at your supplement is something called vitamin A palmitate, and you want to avoid this. There are two forms of this vitamin called the trans form and the cis form. The trans form is found in most manufactured sources, and that's what vitamin A palmitate is. This is not the best form for children with autism. You're going to want to use a cis form that's found in natural sources like cod liver oil, or there are other natural sources you can obtain vitamin A from, such as the beta-carotenoids in a form of mixed carotenoids. Any of those would be fine when you're looking for a good form of vitamin A for your child. The other thing you're going to see you want B vitamins in complex. So B vitamins work synergistically together, and you're probably going to see a number of them like B1, B2, B3. These are all going to be helpful for your nervous system, so you want those kind of included in with your multivitamin. And vitamin B5 is going to be helpful for production of energy in the brain. Vitamin B6 is going to be required again for like 100 enzymatic reactions. Also going to be important for the production of major neurotransmitters like serotonin and dopamine. And it's also going to be critical for the methylation process. Now, there's a little variation. If you're having problems with sulfur metabolism, B6 can be a little tricky in terms of supplementing it in, and you might need to add things like lithium and other nutrients to kind of balance that out. But B6 is again a very critical in terms of neurological support. But just be aware if you're still struggling with sulfur metabolism, then you need to probably address that one a little bit more specifically. With vitamin C, that's going to be a powerful antioxidant, and we know it supports the immune system. Also supports that neurotransmitter function, and so it really neutralizes all that free radical damage in the gut and the brain and all those other inflammation sites that children on the spectrum deal with. If you have too much of it, it can cause loose stool, and it's not going to be recommended for those children who are looking to do the low oxalate diet. And you can also find multivitamins and multiminerals in a lot of forms. There's going to be tablets, there's going to be capsules and liquids. So the form that you use can also be really important.
Now, we've all heard about omega-3 fatty acids. What about omega-3 fatty acids?
So with omega-3, according to the research, the two most beneficial fatty acids are going to be DHA and EPA. And there's also a unique and beneficial omega-6 fatty acid called GLI, which is gamma-linolenic acid, and that's found in borage oil. So it's one of the rare omega-6s that benefit kids on the spectrum. Our Western diet has totally skewed the ratio of omega-3s to omega-6 that we're supposed to consume, and we now do something like 19 to 1 omega-6s to omega-3s. So we really need to balance out the benefits of our omega-3 through supplementation. So with DHA, it's sometimes referred to as a neck-up omega, and this is going to be important for your nerve and your brain cells. And it's also going to be the predominant omega-3 fatty acid that's going to be crucial for young children and infants, because it's really an important period in their life for brain development. So you want to be sure they're getting enough DHA. EPA is going to be sometimes referred to as the neck down omega, and it's going to figure predominantly in inflammation issues and cardiovascular health.
And so how do we know which types that we're supposed to really use? I mean, we've heard of omega-3, 6s, and 9s, and it is a little confusing. And even though I've been around for a while with my son, and I know which products I use, and I often, I just know we're supposed to use this one, supposed to use that one, and then often I forget, well, what does that one do? What does that one do? How do we know which types?
So you're going to kind of maybe look to what your concern is. So for example, if you are looking for supporting that natural form of vitamin A, you're going to look for one that's sourced from cod liver oil, and that's going to have vitamin A and vitamin D in it. I had a child that had a lot of peripheral stims and side glances, and this was one of those crucial supplements where you could tell if you had had it that day or not. And Dr. Megason also has a protocol, and in that she kind of describes how this deficiency in the natural form of this vitamin A can cause misshapen codes and rods in the eye, and it affects their vision. So if you have any concerns with vision, I would definitely recommend something like a cod liver oil. Formulas high in DHA are going to be particularly good for infants and young children. In fact, children like 35 pounds and under probably need more DHA than older children do, since it's such a critical period for that brain development. And from birth to about 5 years of age, a child's brain triples in mass. So it really relies on that omega-3 form to support that rapid growth. And it's also going to be very important for pregnant and nursing moms as well, as they support their children. Formulas high in EPA are going to be good for reducing inflammation, and it also helps with depression. This has been a form of omega-3s that sometimes children with ADHD get referred to because of its inflammation benefits. If you're avoiding fish oils for some reason, there are omega-3 products that are available from algae sources.
Let's change topics a little bit. Let's talk about probiotics, because I know a lot of people that get confused between an enzyme, a probiotic, and an omega and a multivitamin. They take one thing and they think they're taking everything. And so yes. I think it's important to one, understand why are probiotics important, and then also, for those newbies that are out there, some of us that have been around a little longer, clearly we know what probiotics are, but for those new parents, they might have no idea. They might just think eating yogurt is good enough. From those commercials we always see, right?
It's like the research is just pouring in right now regarding the benefits of probiotics, and they're finding more and more things we don't even know we benefit from with probiotics. They're finding out every day. So it's going to be essential for optimal digestion of food and for the absorption of nutrients. And it's also going to help your body produce some vitamins, including several B vitamins and vitamin K and folate. So really important in terms of getting that digestion operating properly. It's going to help with things like the absorption of minerals and also help with the elimination of toxins. So along with some of those benefits, you're also going to see things like reduced harmful bacteria. It's going to compete with nutrients and for the sites, and so that kind of pushes those harmful bacteria out of the gastrointestinal tract. It's going to help relieve diarrhea and constipation. It's going to regulate and balance the microflora in your gut. So again, it helps with decreasing the gut inflammation and permeability there. And it's also going to strengthen your immune system and support activity of those detoxing enzymes. Basically, your gut and your brain talk to each other. A large portion of your immune system is in your gut. I've heard as much as 80% is in your gut. So really important in terms of support for that immune system. And with all that support, it's also going to increase the availability of your vitamins and your nutrients. It's clear that the type and quantity of microorganisms in your gut interact with your body in ways that either prevent or can encourage the development of a lot of conditions. And the ideal ratio you want between good bacteria and bad bacteria in your gut is about 85% good and 15% bad. So you really want to try to maintain that ratio, which is going to be essential for good gut health.
And now, what are things that parents should look for when selecting probiotics?
All right. So there's a lot of factors that damage your gut. Like we mentioned, things like antibiotics and poor drugs and infections and toxic chemicals. And this is where supplements can really help to reestablish the good bacteria in your system. But probiotics are going to be measured in CFUs, which are colony-forming units. At the lower end, you might see something like 1 billion or 5 billion. And 5 billion is probably a CFU number which is considered more of a daily maintenance level. And so something like that might be well suited for an otherwise healthy digestive system. If you have a compromised digestive or immune system, you would probably do better with 25 billion CFUs or above. Another thing you want to look for is a multi-strain probiotic. Different strains of probiotics have different functions, and so probiotic supplements that contain multiple strains are going to be considered more effective because many of those strains work synergistically together. If you're avoiding dairy, you want to look for a label that says hyperallergenic, and that's free from milk and other allergens. Sometimes probiotics are grown on dairy mediums, so you also want to be aware of that. And it's also helpful to look for a probiotic that uses a delivery system that's going to ensure that those probiotics reach your intestines live. It's usually going to be noted on the product's packaging or the marketing material because that's something that those manufacturers are going to really want to pop up to you. One thing I would want to mention in terms of using probiotics is that you don't want to mix a probiotic with a hot food or beverage when you're supplementing it. And if you're taking any sort of antibiotic or antibacterial supplement, sometimes people on yeast protocols are taking antifungals that have antibacterial properties to them. So you want to wait at least 1 hour before giving a probiotic if you're taking any of those kind of products.
Oh, that's really good to know. Now, like I mentioned, a lot of people get confused between probiotics and enzymes. What do enzymes do, and why are they so important? And, I mean, I clearly know what enzymes are, but I know a lot of people still don't.
Yes. Well, very briefly, enzymes do a different job. They're going to be specialized proteins that are pretty much play a key role in every single function that occurs in the human body. So, again, very profound in terms of keeping your metabolism healthy. There are many different types of enzymes, and each one's going to have a very special job in your body. So it basically accelerates a chemical reaction, and there's about 4,000 biochemical reactions essential to life. About half of those are going to involve digestion. So for children with autism, it's been demonstrated repeatedly that they lack the digestive enzymes needed for breaking down foods completely. So these digestive enzymes can be very beneficial, and it's going to help them with breaking down foods and the absorption of nutrients. And once your nutrients are, that you derive from food is being better broken down, there's going to be less waste generated and more regular bowel movements happening. Also, some of the things that can be troublesome with incomplete digestion of food proteins is it's been linked to food allergies. And more thorough digestion will prevent those food pieces from being fermented in the gut. If you have things like food fermentation, that can cause bad bacteria and yeast to proliferate in the gut at the expense of good bacteria. You're also going to see a reduction from the effects of poor digestion, such as that severe bloating, gas, and cramping pain. You'll see less gastric reflux, diarrhea or constipation, and food intolerances. And another thing in terms of giving enzymes is that they're fine for children, even in infants, and you're going to want to adjust your enzymes based on your meal size, not the age or body weight.
So if it's a big meal, you're going to have more enzymes, and if it's a small meal like a snack, you're going to have less, basically.
That's right. And you're not going to, that's going to be the case for a 2-year-old as it is for a 12-year-old.
Now, what if, and I'm just going to throw this question out because I get this question asked a lot from me. What if we forget to take our enzymes? Can we take it in the middle of the meal or at the end, or just when we remember to help and to have some benefit?
So you ideally want to take it right before or the very beginning of a meal, but your stomach is going to digest over a period of time. So if you take your enzyme during or at the very end of a meal, you're still going to receive the benefits of digestion that the enzymes can provide.
It's better to take it when you remember than not at all.
Yes. And I've heard, and you can correct me on this if I'm wrong, but I've heard, even up to 45 minutes after a meal, you still will receive benefits.
Yeah, yes, I always recommend, because my background, obviously, I came from the enzyme more background world before working with Autism Hope Alliance, right? And we always tell people, we used to always tell people, if you forget, take them when you can remember, because it's better to take it when you remember than not at all, because often parents will say, oh, shoot, I didn't do that. Oh, well, I'll just wait till the next meal. We're like, no, take it when you remember it at the very least. And then also, the tips that we give, and you can correct me if you agree or not agree, but, a lot of people will say, well, what do we do if they can't swallow the capsule? We tell them to open it up and just put it in the first bite of food, as long as it's not really warm, because we don't want to denature the enzyme or kill the enzyme. So room temperature is fine, like the first bite of applesauce or something like that. You just want to make sure you get it in their system. Same thing with the probiotics, same thing, with any of the other stuff we have to try to hide. And then one thing especially, I can speak on enzymes, not so much the other supplements that you're talking about, but I noticed this with my son, and I think this is a great tip for families out there. If you are breaking open the capsules, what sometimes happens is the dense skin cells around the mouth starts to be eaten away a little bit, but not in a bad way. It's just basically the enzyme is just basically getting rid of the dead skin cells. But you might start seeing dry and cracked lips, because technically that enzyme was, designed to swallow in the capsule form. All you need to do is, before you give the enzyme, if you're going to break it open like that, you want to put a little, some version of chapstick, clearly make sure it's gluten-free, dairy-free, we always recommend, or even just a little coconut oil or olive oil on the lips to create a barrier, and that helps out a lot. And then the children no longer what I used to call the Joker mouth, where the sides would just kind of go up. They're not having an allergic reaction. The enzyme is just getting on the dry skin cells. So just a fun good little tip for families.
I found it one of the easier supplements to give. I didn't find, taste-wise or look-wise, it was that difficult to mix with food. And in fact, my son would even hold his food out and let me sprinkle it directly when he was eating. So he thought that was part of the meal. So, yeah. So you can really kind of, just by the way you act, I think kind of make them more comfortable with it as well.
I think a lot of times that happens when, especially, at least I can speak for me, like, in the beginning, it'd be like, oh, I know this is going to taste gross. Like, why am I, and then that face you would, kind of make, and kind of reminded me of when my grandmother would give me, something when I was sick, and it would just taste disgusting, some oil that, she learned about on the farm or something going on her day, and I'd be like, no, Grandma, I don't want that. And she'd say, well, no, you have to take it. And the face that she would even make is the same face I would make trying to give my son some of these supplements. And yeah, and it's like when you change your thought process of like, no, I'm going to be so super happy and excited over this supplement, because this could really change my child's life, and this could really benefit my child to be able to have better attention, better poops, better sleep, being able to feel better, being able to receive therapies better. I mean, the list really goes on. And so when I thought of the supplements as my friends and like a really key player in this whole puzzle, it made it a lot easier to be really happy and excited about it. The other thing I always recommend to families is try it yourself. A lot of times we have this idea and this preconceived notion of what we think it's going to taste like. And I think minerals are a good version of that, because a lot of times if they're a humic acid or something like that, they come really dark, and you think, oh, it's going to taste like dirt. And then you drink it and you go, well, it doesn't really taste like anything. But in your mind, you think, oh, it's so disgusting looking, like it must taste gross. And so I think a lot of times,
I was pleasantly surprised by glutathione. I thought that would taste horrible because it was a sulfur compound, but no, I thought it kind of tasted lemony to me, so I didn't have a problem with that.
It didn't smell like rotten eggs.
No, I just thought it was going to be terrible, and I was really kind of pleased about that. I took it straight, and I was like, I can take this. I don't even need to mix it in juice or water or anything. So definitely, in terms of making them more comfortable, you really can have an influence on that. And I've also heard enzymes can also help with, like if you have yeast, it can help, clear out some of the yeast, metabolites and issues and in the gastrointestinal tract too. So it kind of works a little bit in a cleaning way as well in terms of the gut. So it was always something we found, just really made meals go a little bit smoother and foods go a little bit smoother for my kids.
Well, especially when our number one goal is to get our kids to poop, right? And so
yeah. And,
it's nice to say the word smoother.
It's really one of those very crucial things. And for parents and kids that really have to work with constipation or diarrhea, I mean, it can just be, such a relief in terms of getting that regulated again. So
now, are there things parents should look out for when they're selecting an enzyme? Because I know in the back of the bottle, sometimes it can kind of get confusing with all the words like amylase and lipase and protease and all these different things. And then how they measure it, and what can they look out for when they're trying to select an enzyme?
Well, again, I'm just going to very briefly touch on a couple of enzymes that can be helpful. Children with autism often have those food intolerances and those special dietary needs. So if a parent's concerned about things like phenols or gluten or casein, there are going to be digestive enzymes that address those specific concerns. So if you're concerned about gluten and casein, you want to look for something like the DPP4 enzyme complex on your bottle. That's going to be the protein that's going to break those gluten and casein peptides down. And I've heard for maximum protein breakdown, it's also beneficial to combine it with other proteases. And proteases are going to break those proteins down. For phenol-sensitive children, there's the enzyme called xylanase, and that's going to modify the structure of phenols. So it may allow phenol-sensitive children to ingest phenols without those adverse effects. Again, when we were talking about sulfur, we were talking about the red cheeks, the ears, rashes, or any kind of shiner under the eyes, kind of a sign that they're having a phenol reaction. Some parents report improvements like increased verbalization, more awareness, social behavior towards family and other people. So, generally, if enzymes are going to make you feel better, it's definitely going to do things like improve moods and help you be more social. And for children with chronic constipation, it's going to mean more frequent bowel movements. So that's awesome.
And I think that's so important because, often, guys, the people who are listening out there, the moms and the dads and the professionals and the grandparents and just everybody that's listening right now, with our kiddos, if they don't poop and they're not sleeping well and they're not feeling good, it doesn't really matter what we're doing throughout the day because they can't focus. And with enzymes and probiotics and the omegas and the multivitamins and everything you've talked about today, all of that, it plays a critical piece to this puzzle because I believe so many of the behaviors are being caused by, deficiencies and then also just not being able to absorb their vitamins and nutrients in a way that they really need to be doing because they, for whatever reason, can't. And so I love how you really simplified it so easily for so many of us to listen to, especially with these words that we're not always used to hearing, right?
Well, really you can kind of know that when you're looking for like improving moods, B vitamins are, going to be helpful for moods. And it's not always helpful to think of, okay, this one particular vitamin is going to work in that one particular way. I think when you can kind of see the overall picture of pathways or, supporting detoxification or methylation, you kind of see a bigger picture. And, one of the things I forgot to mention with the enzymes is if your child has any kind of food coloring issues, you can also use the xylanase for that as well. That's another, behavior you could see kind of crop up with phenol intolerances. But it's, magnesium was crucial for my son in terms of just getting his sensory stress out of his system and relaxing him. And so there's it can get, you definitely want to take the next step in terms of, finding out what is important for your child, because every child's going to be unique here. And so they're all going to have, different metabolic, kind of challenges. But I think in general, in terms of just getting that broad base of support, all of them are kind of working together. The omega-3s are doing their part, the vitamins and minerals are doing their part, and this really does kind of impact how a child's going to feel, and from there, everything goes better. They can learn better, they can sleep better, they can eat better, and everything you do, I think, from that point on, once you've kind of got this base established and got them feeling better, is going to have a better outcome.
So now, after we've learned all of this now, and we have all this good stuff in place, what's the next step we're supposed to do?
So the next step, and like I said, all these products are things you can go out and start shopping and purchasing. There's nothing in here that requires doctor prescriptions or any kind of special appointment to obtain. But you do probably want to find a physician that's going to be open to biomedical interventions to take you to the next level. Every child's going to be unique, and so if you don't see the results you're looking for when you've kind of supplemented, things like vitamins and minerals and fish oils in place, testing can sometimes cue you into what's specifically happening with your child and how you can really perhaps work with his biochemistry a little bit differently and better, so that you do see the results you're looking for. There's also supplements we haven't talked about too much today, things like amino acids, GABA, CoQ10, mitochondrial support, carnitine, and then there's the phosphatidylcholine. For more information about those supplements, I'm going to recommend this book for you called The ADHD and Autism Nutritional Supplement Handbook. This is one that was written a couple years ago by the doctor and nutritionist. It's Dr. Kumpart and Dana Lakey. And I found them very helpful in terms of how they broke down what these supplements do, and also put together, if you're looking to really help with something like sleep, or you're really looking for, constipation support or something, they'd really put down and put together products that can kind of help you with those specific challenges. Another step that you're going to want to think about is improving diet. That's going to be very important. As much as you can, reduce the intake of highly processed foods, high in sugar or food dyes. You want to eat good quality foods, buying natural and organic alternatives when possible. And there's also special diets that might be the next step for you. There's gluten-free, casein-free diets. There's a specific carbohydrate diet, low oxalate diet. There's the Fine Gold diet and the body ecology diet. So you might want to look into, working with your children's diet a little bit more, and sometimes you can have very good results in that direction as well.
And sometimes you have to cross over those diets too. So sometimes you'll take a little bit of this diet and a little bit of that diet. That seems to, every child's different, so you have to kind of tailor, at least from our experience, we've done a little bit of this, a little bit of that, and kind of figured it out what worked best for our son. So just to keep that in mind to some of the families listening.
I have 2 children on the spectrum, and I have to supplement them differently and feed them differently. And so even 2 brothers with the same parents and same house and everything like that had very unique, ways to display their autism and their challenges. So, again, it's going to be really trial and error and finding out, what works the best for your child. And if you're not seeing the results, you always can move forward with a doctor open to these interventions and take some further testing to find out what might be uniquely happening with your son or daughter.
It would be nice if it was a one-size-fits-all, but unfortunately
it really
not.
would. It's such a complex disorder. It truly is, and it's something that every parent's going to have a different story about in terms of what they were challenged with and so forth. But I do feel that these are basic nutrients that could benefit everybody. So whatever level your child is experiencing with their autism or their ADHD, these are going to be supplements that are going to put them and have them feel better and put them on the best foot forward in terms of healing.
Well, I can't believe our hour is almost up. I feel like I learned so much, and I love hearing it in such a way that you explained it. I think the families got a lot out of this. What is the what's a message you want to make sure you leave parents with today?
What I'd really like to do is kind of empower parents so that they feel comfortable going to, their pharmacy or wherever, their health food store, and choosing supplements. And so if they have any questions in terms of, what kind of nutrient to look for, what form to look for, they can always give us a call, 305-952-3227. And we'd be happy to, to support, to support their knowledge and their understanding of supplements. And I really want parents to feel like they can go out and do it themselves. And there's a lot of money that gets invested in doctor's appointments and testing and so forth. But you can make, I think a night and day difference sometimes in terms of what we've talked about today. I don't think, you have to wait 6 months to be on a wait list for a doctor to really make some very significant help and benefits for your children, just in the form of vitamins and minerals and fish oils and so forth.
Absolutely. And can you go ahead and give that number again, and then also a website if you have one?
Sure. So our number is 305-952-3227, and you can find us on our website at www.brainchildnutritional.com.
Thank you so much, Celeste. I think you've been a great tour guide today on helping us navigate through all the different supplements that we can choose from, and a great way for us to figure out how to start. So thank you so much for taking the time and helping so many of our families.
Thank you very much for having me.